Good morning. It's Dr. Badia. Thanks for joining us for the introductory session of our Instagram podcast entitled Fixing Healthcare from the Trenches. Many of you have heard a commentary I've made, whether it be with seeing patients or in the operating room, about the hurdles that we continue to face in trying to deliver this kind of healthcare in the richest, most powerful country in the world. We need to fix this, and it's going to have to come from the trenches. It is not coming from DC. There's some problems going on there right now as we speak. It's not going to come from the insurance companies. It has to come from the people delivering the care and the public. So if you think that this conversation is interesting, and it will only be 15 minutes at first, then please share it. Don't like it, but share it and get people to talk about this. You'll be able to write in some questions. So I'm going to be introducing now our first guest. This is our very first guest, which I think is fitting because he's a young physician. Dr. Greg Jasani is an emergency room doctor. So you can imagine the last few years, ER doctors were, they've always been heroes in my eyes, but certainly they have been stressed. And Dr. Jasani works in our nation's capital. He is an ER physician at the VA hospital, so he treats our veterans. Very, very noble task. He is an assistant professor of emergency medicine at the University of Maryland. He trained there. He attended the George Washington School of Medicine in DC, and he's going to be joining us now and talking about the problems from his perspective, being in the trenches in our nation's capital, in a veterans hospital, taking care of patients every day. Dr. Jasani, we look forward to him signing on now. A little more background when he comes on, then we'll fire some questions. I do want to give a little more background in him. I chose him to join us because he's written multiple articles for Kevin MD. Kevin Poe is an amazing podcaster, a primary care doctor in the Northeast who has a podcast and website and has physicians really write fantastic articles talking about the issues in healthcare delivery. So I had the honor of being on his podcast some time ago. Several topics that Dr. Jasani has written about. One is violence against healthcare workers. There was a lot of this when people were stressed during the pandemic, and nurses, physicians, techs were actually being assaulted, which is incredible. Something unfortunately we're seeing in the travel industry now. So I'm not sure the exact cause of this, but this is certainly unacceptable. He also has written an amazing article about addicted patients with substance abuse who come into our nation's emergency rooms. That costs our system a lot of money, and we have to start making hard choices about whether we may need to really enforce treatment on some of these people. Can they make decisions on their own when they're in that condition? It's jeopardizing their life and that of others. Another one that he wrote about was the value of wearing a mask. Obviously very controversial, but in September of 2020, he wrote a very important article talking about trying to limit the spread of the coronavirus, particularly the more virulent forms at that time, and what he was seeing intubating people in the operating rooms. So we're waiting again. These are now the technical glitches of the first launch. So we're waiting for Dr. Jasani to sign in. How are we looking there?
He is currently on his PC and switching to his phone. So okay. Just give him 1 minute, and I guess you can continue to discuss.
Yeah, I'm not sure. I'm not an Instagram expert. This happened all very, very organically. So a little background on me for those who don't know me. I'm an orthopedic hand surgeon. I've been in practice for nearly 30 years. I trained in New York, Pittsburgh, then Germany, which gives me a different perspective. During the pandemic, I wrote a book called Healthcare from the Trenches, which talks about these challenges and is the springboard for what we're doing here. So in this book, I talk about the fact that the changes need to come from us. the people actually delivering the care, not paying for it, not blocking it, but actually the people who deliver it every day, and then from the public. So the idea here is to spread these ideas and get a national dialogue going, and that is the intent. Flew out to LA to do that in person with him, and we have very much the same stance. He covers a variety of issues. He is an internist and addiction specialist, but he sees these problems that we're seeing, and that Dr. Jasani is going to be able to tell you about. So there we go. Dr. Jasani, welcome to the podcast, Fixing Healthcare from the Trenches. How are you this morning?
I'm good. Thank you for having me. Sorry, it took me a little bit of time. I'm fairly new to Instagram, so still figuring.
Well, the problem is that most of us are busy, right, caring for patients. So this is not this brings up an interesting point about how everyone seems to know about this unfortunate incident with the football player, right? And yes, it's terrible, but these are things you see, Dr. Sadi, every day, right? Tell us what your days are like being an emergency room doctor and the challenges you face.
Well, first, thank you for that lovely introduction that you gave me prior to me coming on. Although I couldn't join, I was able to hear all of it, so thank you.
Wonderful.
I particularly appreciated you referring to me as a young doctor. That was
well, it's all relative, right?
But yeah, to your point, that obviously what happened with the football player was very jarring because it was, streamed into millions of households across America. And, a lot of people got a very raw and up close look at that. But, as you correctly said, that's what, me in the emergency room and my colleagues across the country, that's what we deal with every day. We're seeing people who are very, very sick, who, because of the pandemic, I think have had a lot of trouble accessing some of the basic care that they might have had beforehand. And so they're getting sicker. And, one thing that I want people to keep in mind, as we're talking certainly about this topic is that, when that happened on Monday Night Football in I think halfway through the first quarter, everything stopped. The game stopped. They didn't resume it. All the players and the coaches and the staff got to kind of stop and process what they'd seen and been through. For us in the emergency department, we don't really get that.
Right.
I've had codes that come in at the start of my shift,
Right.
and you deal with it, you get through it, but then you still have 8 to 10 to 12 hours left of your shift to work, and there's not really a lot of time to stop, at least in the moment, and process what happened because you've still got an ER full of patients that you're responsible for. And I hope that, as there's been increasing dialogue around this as a result of what happened, I hope people remember that aspect of what we do. You mentioned in your intro that there's been more and more violence in healthcare recently. And I not that I think this will solve it, but I hope this provides the public with a little more understanding about what it is and what we do, and hopefully
Yes.
a little more compassion.
Yeah. People the complaints I often hear from patients is that physicians have become very callous and they don't care. And I think they don't realize the pressures we're under, not only to do the medical part, but there's all this bureaucratic stuff that now I'm at a point in my career, unlike yourself, Dr. Sani, where I've slowed down quite a bit. So I get to ask my patients about how's the family, how the kids. I talk about their hobbies, which is wonderful. But the reality is that many of our colleagues, particularly our primary care colleagues, our primary care doctors, are really under the gun. And it's not that they don't care, it's that they have to treat, just like you do in the ER, they have to focus on the medical care. And unfortunately, there just always isn't the time for what I think is one of the more critical parts of medicine is the interaction with the patient. And the compassion is there, the caring is there. If not, we wouldn't show up for work, right? Just a few days ago, we averted a 4.5% pay cut. Again, we're the only profession where our pay is actually being whittled away. And so we celebrated that it was only 2%. Well, guess what? We're in an 8% inflation environment. So we are actually earning 10% less. And I can tell you, I don't get to pay my staff less. My rent, overhead doesn't go down. Our malpractice insurance doesn't. All the other costs. So these are the pressures physicians are facing. So I salute you and your colleagues for going into the real trenches of healthcare every day and taking care of people in real need. I'd like to know what what your thoughts are on that.
Yeah, I first off, thank you. I appreciate that, those kind words. And yeah, absolutely. As you said, we're not in this business because we don't care.
Right.
Are there some? Probably. Every field has its, people who go into it for the wrong reasons. But every doc I've worked with, and certainly every primary care doc I've worked with, cares deeply about their patients. But as you said, there are real forces acting against us to deliver not just sound medical care, but compassionate and empathetic and understanding care, which I think at the end of the day is what our patients want. And, there are only so many hours in the day, right? We can only do so much for our patients. And especially with the pay cuts that are coming in, I think you mentioned the piece that I wrote about this, but it's really hitting primary care doctors the hardest. They're already get much lower reimbursements compared to not to say anything bad about you, but proceduralists.
No, it's true. It's absurd. They keep us healthy, and that's one of my pillars is really reimbursing that better. And so yes, but you practice right in DC. That's where it all happens, right? And it's a stressful time. Well, it's been a stressful time in DC, and healthcare keeps really after the Clintons, healthcare has been really pushed down. And then we know what happened with the ACA. We know it didn't lower, that Obamacare didn't lower healthcare costs. There's some good things came out of it, but you're in the right place. And I remember I had breakfast. It was with my children. It was really an honor to meet with Senator Bill Cassidy, and I had breakfast with him in the Senate dining room. But what a lot of people don't know is that Bill Cassidy is a gastroenterologist. His wife is a general surgeon. So obviously he cares. The question is, can he and the other few physicians in the House and Senate influence our colleagues enough to really make some changes? So I'd like to ask you in DC, what would be, and you didn't get to prepare for this, so I'm just going to say that. I'm going to ask you off the top of your head, what are three steps that you think we can take in general to lower healthcare costs? And I'm not going to talk about quality. I think the quality is there. It's just we got to get rid of the hurdles and improve the access. What are 3 points?
Absolutely. And, you talk about the senators influencing us. I think it would be better to talk about what we can do to influence them. Senator Cassidy, yes, is a physician. But unfortunately, there aren't enough of us in Capitol Hill, making these decisions. I think there's only a handful of physicians in both houses of Congress.
Yeah, I think 14. Yeah, I think so.
Yeah. And that goes back to, again, we're focused on providing for our patients, and that doesn't leave a lot of time to campaign and run for office and, do things like that. But to answer your question, 3 things that I think we can do. I think the biggest thing is making more of an investment in primary and preventative care.
Okay.
They say the best offense is a good defense, right? Well, the best medicine is preventive medicine.
Absolutely.
You and I both are great at fixing problems once they occur. I'm at diagnosing and treating the stroke once it happens, or diagnosing and treating the complications of diabetes. You're good at diagnosing and treating, the complications of arthritis or whatever else it is. I'm sure you do much more than that. But my point is, you and I are both good at fixing problems once they occur. It is much cheaper to the healthcare system to prevent those problems from even happening. Preventing
Perfect. So that's number 1. Agreed. Yep. So number 2.
Number 2 is, and going along on that is, I think Congress has to incentivize more physicians to go into primary care. And I think a big part of that is starting with increasing their reimbursements. Medical students on average graduate with over 6 figures of debt when all said and done, between college and med school, and for their 3 to 7 years of residency, they're only making about 50, 60K a year. So they're not really making any progress towards repaying those loans. Is it really a surprise then that physicians are choosing the specialties that reimburse better when looking at what they want?
That's been a big push, as you know, to try to do that, but we haven't been successful. So that's number 2. So what would be the third thing?
Third thing, I think if we get those 2 things, I think the third thing for us is making more of an effort to engage with our patients to get them plugged into primary care. I think we in the medical field, unfortunately, have lost a lot of ground. A lot of patients just don't have primary care docs anymore, and it's not something that a lot of people are used to doing,
They
going
go
and seeing their.
to you, right? They show up in the emergency room, which is
They go,
expensive care, and yeah.
I'm good at a lot of things, but I'm not a primary care doctor.
Right.
And I we would have to really work to make a cultural shift to get patients back and engaged in the preventative aspect of medicine as opposed to the reactive phase of medical.
So I'm going to give you my three things, and I'm going to harp on this. So, by the way, this is going to be a weekly podcast. It's going to be for now, it's going to be every Thursday. We are actually reaching the end. I know people are busy, and we want to be focused. So just to start to close out, every Thursday at 9 a.m., we will do this. So my three things, the first one is see the right clinician at the right time. So right clinician means, it doesn't necessarily mean the emergency room doctor if you break your wrist, because you will splint it, but you're not exactly, the right person make the decision whether it needs a cast, pins, surgery, or right. Okay, so that is the first one. Number two is patient education. So for what you said, to be able to get to educate them as to where they need to go, and that's a big step. And now with social media, we can do that much cheaper than in the past, right?
Yes.
And the third one, I think, and I'm going to keep harping on this, is abolish authorizations. I'm going to call it oversight, not authorizations. Oversight means, of course, there are physicians, you said at the beginning, who may be overutilizing, maybe often occasionally doing the wrong thing. So it's okay, whether it be insurers or colleagues, medical boards, to give oversight. But to stand in the way of every decision with an authorization and approval by somebody sitting at a desk, that costs the system a lot of money. And I'm going to be presenting some very real cases of that as we go along. That very concrete examples, because I think people understand the examples in the trenches, not the statistics, which are already out there.
Yes, it causes a lot of headaches for you and me too. All the authorizations.
Wonderful. So, well, Dr. Jasani doesn't have time for authorizations. If somebody comes in like our football player with a stopped heart, there is no chance. When somebody comes in with an open tibia fracture, like I treated at Bellevue Hospital for many years, there is no time for authorization. But yet in the private practice world, I've had people come in literally with a finger dangling from a circular saw injury in their garage, and I have to wait for one of the insurance companies to give me a little number. And of course I don't. And what's the consequence? I do the treatment that's needed, and later on they say, oh, doctor, we can't pay you. You didn't have prior authorization. This has to be a national push. So I'm glad that we discussed a lot of critical points, and I'm looking forward to feedback from people on this podcast and to share it. Please, if folks, you think this is interesting, don't like it. That's, Dr. Jasani and I both probably have big egos, but we don't care about that. We want this other people to know that this is going on, and please, and critique us. What can we talk about? So we will see you next week. And Dr. Jasani, thank you for being our inaugural guest. We'll see you next week on fixing healthcare from the trenches.
Thanks so much. It was a pleasure. I wish you the best of luck, and I hope you'll have me back again soon.
Thank you. Bye-bye.
Bye now.